I work for UCare, of course. I'm going to be presenting the information to you today. Inside your packet, there's going to be a PowerPoint. You can follow along on that. A little bit about me. I've been with UCare. It'll be 20 years for me this year. So I've got a lot of history with the company, UCare. Some of the things that we're going to cover, we'll talk about in the presentation. We're going to go over your rights. I'll give you a little background on UCare and how they came about. We'll talk about MMC. We'll talk about what's covered, what has to be covered, some of the qualified or essential health benefits, insurance terms, what's a deductible, what's a copayment. We're going to cover things like that, how to select a plan, how much plans will cost, benefits overview, and how to enroll on MMC at the end. And then, throughout the presentation, if you have questions, just jump in and ask them, because it's, just you and me, and we should be able to get through this. All right. So if you want to follow along in your handout there, again, feel free to ask any questions that you might have. Any complaints or concerns that you have regarding the content of this presentation, you can direct those to UCare at the numbers listed there on the screen, or to the Commissioner of Health. And I can back up and give those to you later. They're not going to be in your handout there, those numbers. And then a little bit about our company. UCare is an independent nonprofit health plan. We're a local company. We're based right in Northeast Minneapolis, so not too far from here. We serve about 143,000 members now. We've been around for more than 30 years. We started out back in 1984. We were created by a group of physicians from the U of M. So that's where we get the U in UCare from. So we've been around for a long time. So what is MMC? MMC is the state-based health insurance marketplace for Minnesotans. It's a website. When you think about MMC, it's really just a website. A lot of people call us up and they get us mixed up with MMC. Well, we're not MMC. We're just one of the health plans that you can find out on MMC. MMC only works with certain web browsers, so Google Chrome or Firefox is what's recommended. It's a one-stop shop for you, basically. It's where you go and you shop and you can compare the different plans that are available through the MMC marketplace. It's side-by-side shopping. There's consumer contact center hotline that you can call. And then there's going to be places in the community where you can sign up. They're called Navigators or in-person assisters. They're placed all throughout the state of Minnesota, and these people are trained and certified by MMC to assist folks with enrollment. Okay. And then what must be covered? With the new healthcare law, there's essential health benefits that must be covered. It's a set of healthcare service categories that must be covered by all qualified health plans. It's not going to be a qualified health plan if it doesn't cover these benefits. It must include coverage and services within at least 10 predetermined categories, like emergency care or newborn care. Prescription drug coverage is a big one. Preventive services. Those are mandatory benefits that must be covered.
So you have to have those so you don't get the penalty then?
Yeah, you have to be in a plan that covers the qualified, so you have to be in a qualified health plan in order to avoid the penalty. Good question. Yeah. And so in order for it to be a qualified health plan, it's going to include the coverage and services within these categories that I've talked about, like, again, newborn care, prescription drug coverage, preventive services. That's a big one. Pediatric dental is another one. So those are mandatory benefits that must be covered under all qualified health plans. And I'm going to back up. If you wanted to know what those essential health benefits are, you can go to healthcare.gov and type in essential health benefits, and it'll list them all out for you there. Preventive care, again, this is one of the essential health benefits. It's routine health care that includes screenings, checkups, and patient counseling to prevent illnesses, disease, or other health problems. So your routine physical, mammograms, pap smears, it's preventive services. These services are covered at 100% before deductible, and it's covered under all health plans. It's a mandatory benefit, so you won't pay anything for these services. And if you wanted to get a complete list of the services that are covered under the preventive care benefits, you can again go to healthcare.gov and you can get that information there. And type in preventive benefits and it'll give you that information. So here's where we get into the healthcare terms, like a deductible. Do you know what a deductible is?
Yeah.
Okay. So some people don't know what a deductible is. The deductible is the amount that you owe for covered services before your health insurance or plan begins to pay. So for example, the example here, if you have $1,000 deductible, that means that for most services, you're going to pay 100% until you've paid that $1,000, and then your coverage will kick in. So let's say, for example, you ended up in the hospital and you had a $1,000 deductible. That means you have to pay the first $1,000 of that hospital stay. Then your coverage is going to kick in, and it's usually at a percentage, and it could be 80%, it could be 100%, but that's when your coverage kicks in after you meet that deductible. Again, some plans, some things will be covered before deductible, again, like your preventive services. That's mandatory. Some plans out there offer benefits up front before your deductible as well. So when you're shopping for a plan, it's a good idea to ask, what are your upfront benefits before deductible? Like you might get your first 3 office visits with just a copayment before deductible. Does that make sense?
Yeah.
All right. And then this is a very important term, and for a lot of people don't know about this. I really didn't know about embedded versus non-embedded until I started selling individual plans. When it comes to embedded versus non-embedded, there's 2 different types of deductibles that you can have with a plan. There's going to be an embedded deductible or a non-embedded deductible. With an embedded deductible, that plan is going to contain 2 components. It's going to have an individual deductible and it's going to have a family deductible. So that means the individual deductible is embedded within the family deductible. So if I'm on a family plan, let's say there's 3 people on my plan. I'm on a plan with my husband and my child. I get sick and I end up in the hospital and I have an embedded deductible. That means I just need to meet the individual deductible and my coverage is going to kick in. And then any combination of those other 2 family members can meet the other half of that deductible. But it takes at least 2 people on a plan with an embedded deductible. It takes at least 2 people on a family plan to meet that deductible, the entire family deductible. One person alone won't meet the deductible on a family plan, the entire family deductible. Does that make sense? Okay. Whereas with a non-embedded deductible, there's only one component, and that's going to be the family deductible, meaning the family deductible has to be met before anyone gets coverage. So if a person ended up in the hospital, if I'm in the hospital and I'm on a family plan, let's say I have a $10,000 family deductible or a $5,000 individual deductible, well, I have to meet the entire family deductible on that plan if I'm on a family plan. Does that make sense? Okay, so if you're on a plan with a non-embedded deductible and you're just a single person, then you just need to meet the individual deductible, okay? So in a case where the plan might have a $5,000 individual deductible or a $10,000 family deductible, in that case, you're only one person on that plan. You're not on a family plan, so you just need to meet the individual deductible. Coinsurance. This is what coinsurance means. It's just a percentage of the amount that you have to pay. So that's all that means. And coinsurance is usually after your deductible. After your deductible is met, that's when your coinsurance amount kicks in. So for, let's say, in this example, you've already met your deductible and you go in for an office visit and that visit costs $100. And your coinsurance amount is 20% after deductible. That means you're going to pay a $20 copay. Okay? And then with a copayment, it's a fixed amount, like a $40 copay for covered healthcare services. And this is usually at the time of service. It can vary depending on the type of service. The copayment can vary. Office visit might be $40. You might have a, if it's a drug copay, then you might have a $10 generic drug copay. So it really varies on the type of service that you're having. You might pay more for a specialist visit than you do for a regular office visit. It just depends on the health plan the coverage that you have. Formulary, this is something you'll hear when you're out shopping for coverage. Formulary is just a list of prescription drugs that are covered by the health plan. So all health plans are going to have a formulary of the drugs that they cover. So if you take a certain medication, you want to make sure that there's coverage for it. It's important to ask if that drug is covered under the health plan's formulary. Also called a drug list, okay? There's 149, I think, classes of drugs. There might be more now because I think they have to cover more, maybe 150 or so. And there's two, all health plans have to cover at least 2 chemically distinct drugs in all classes. So I'm saying that to say that if you take a medication one medication that's not covered, something else on that health plan's formulary might work for you, okay? The out-of-pocket maximum, what this is the most that you're going to pay during a policy period, usually 1 year before your health insurance will start to pay at 100%. So the most you'll pay, and you will have a maximum amount that you would pay for in-network services. So it's not like you'll have $1 million bill and have to pay, 10% of that or whatever. You'll have a maximum. I think the maximum out of pocket this year is the $68.50 is the most that a plan can charge you for individual. For family, it's going to be 2 times that amount, I believe. And then advanced premium tax credits, or APTC. First of all, the only way you're going to get this is if you shop through MNsure. Okay, what this is it's put in place to help lower your premium if you qualify. Some people, based on their income, may qualify for this, and it's not something that you have to wait until the end of the year to take. You can take it up front. When you're shopping through MNsure and you qualify for a tax credit at the end, it's going to ask you, do you want to take all of it, some of it, or none of it? You can opt to take none of it up front and wait until the end of the year and get it back on your taxes. People who fall below 400% of the federal poverty level might qualify for a tax credit. Now, your income still could fall below. That's not all that they look at. They look at your age as well and the plans that are available. So you could fall below the threshold and still not qualify, and it's probably because there's the plans that are available to you, they're already so low that you don't qualify for the tax credit. Cost sharing reduction, what that is, this is another discount that you might qualify for, and what this does is it lowers your out-of-pocket costs, like for deductibles. If you qualify for a cost sharing reduction, then you might qualify. A lot of people, what we see a lot of is a 73% cost sharing reduction. So you'll know that when you put your application through MNsure, it'll tell you what you qualify for. If you qualify for the cost sharing reduction, it means that you're going to have, for example, with our silver level, you have to enroll, first of all, you have to enroll in a silver level plan in order to take advantage of the cost share reduction. You could qualify for both. So let's say you qualify for the tax credit and the cost share reduction, and you don't want to take the cost share reduction. You still can use your tax credit to get the lower premium, but you won't get the lower deductible if you don't enroll in a silver level plan. So you could still take that tax credit and go take a bronze plan or a gold plan or a platinum plan, but you won't get the cost share reduction if you opt. So in order to get the cost share reduction, you have to take a silver level plan. Does that make sense? All right. I said a lot there, so I just want to make sure I'm real clear on that.
So what does that mean then with the silver level?
Well, when it comes to the different plans that are out on MNsure, they're going to be what's called metal level plans. So bronze, silver, gold. There's no longer a platinum level available through MNsure. You have to go directly to the health plans for those levels. That's the top level. And so when you're out there shopping, you can take your tax credit and you can apply that to any level of coverage. But if you qualify for that cost share reduction, you have to enroll in a silver level plan in order to get that reduction. Okay? You know, but it could make sense for you to enroll, you know, in maybe a gold plan, because that has a lower copay or a lower deductible than what you would with that silver plan, and, you know, take advantage that way. So you really got to look at all your different options and what makes the most sense to you, okay? How do you choose or select the plan that's right for you? Well, you have to consider your financial, you know, considerations, first of all. You know, what can you afford? You know, that's really upfront. Provider network is very important. If you have a certain provider that you've been using or that's really important to you, you don't want to change doctors, that's one of the first questions that we ask. Where do you go to the doctor at? If it doesn't matter, then, you know, your options, you'll have more options. Current health conditions. You know, if you're really healthy, you never go to the doctor a lot, you might want to consider a lower level plan like a bronze. If you're less than 30, there's even if you're under 30 years of age, there's even what's called the core plan out there, or catastrophic plan. Our catastrophic plan is called the core plan. You will only see this plan pop up if you are under 30 years of age. Otherwise, it's not going to show up when you're shopping on Insure. You have some really expensive meds or some office visits or maybe a expensive procedure that's coming up. You might want to consider a higher level plan like a silver or a gold or even a platinum. Health services, preventive health services, again, are going to be covered under all plans at 100%, so you don't have to worry about that. That's covered up front, okay? Catastrophic plan, again, I talked a little bit about this. To be qualified for the catastrophic plan, you do have to be under 30 years of age, or you have to qualify for what's called a hardship exemption. If you qualify for a hardship exemption, then you're most likely going to qualify for Minnesota Care medical assistance. So it wouldn't make sense to do this. You usually you won't get any benefits other than your preventive services and your first 3 primary care visits before deductible. Whereas with the other plans, it could be, you know, a combination of different types of office visits that are covered up front. With the catastrophic plan, again, it's specific to primary care for those first 3 office visits and preventive services. That's the only coverage you will get before your deductible. Okay? Also, with the catastrophic plan, if you choose to go that route, if you did qualify for a tax credit, you can't use it with the catastrophic level plan. So it might make more sense to go up to a bronze level so that you can take advantage of that tax credit. And then health savings or high deductible plans or health savings accounts, HSAs. These are really out there. Most people who enroll in these have money and they can afford to have these. What these are they're tax free. So the contributions are tax-free, so people use them as kind of like a savings account. For some it works. You do have to have a medical savings health plan or a health plan that goes with this savings account in order to continue to contribute to this type of plan. The premiums are usually lower. Preventive care only before deductible, that's it. And then again, you have to have that separate savings account to pay for those benefits. So you're going to be paying for pretty much everything up front other than your preventive services before deductible. Otherwise, and it's usually a really high deductible plan, like a $5,000 or a $10,000 deductible. And again, people like to use these for tax purposes. In your handouts, in your folder, there's a really good handout on HSAs. You know, some other things to point out about HSAs, once you turn 65, you can no longer contribute to an HSA. Again, these are really good handouts. If you have questions, I believe there's also a number on this handout that you can call, and they can answer questions. They're more qualified to answer and know more about the health savings accounts. But again, these you really want to be careful and make sure that you don't enroll into something like this, because if you think you're going to be covered, you won't. You'll be paying for everything out of pocket. It does work for some people if they want to cover services that aren't covered, like I don't know, there's different types of, what do I want to say, acupuncture, things like that, that aren't, traditionally covered, traditional types of medical care. Then you might want to use that, or, if you needed to get like a wheelchair or, a seeing eye dog, it helps pay for things like that. And you can use the contributions from that health plan for that. All right, and then how much will you pay? Now, this depends. So first of all, you'll have monthly premiums you have to pay for your plan. Your deductibles, these are the types of costs that you're going to incur. So you'll be looking at deductibles, co-payments, coinsurance, the things that we just covered. Those are the different types of costs that you're going to come across when you enroll in a health plan. Summary of benefits and coverage. This is what helps you compare and what you need to look at when you're looking at what's covered under the health plan. In your folder, there's a couple of different examples. I want to pull those out because one actually points out an HSA plan. The first one is actually our UCare Choices Bronze. So this is where you want to go. It doesn't really give you everything in detail, but it gives you a lot more than what like our website or our brochure would look. And you can also find these on our website or on the health plan's website, or call the health plan if you can't find this. This is where you want to go to look at what type of upfront benefits you're getting. Like with our plan, if you go to the second page, your upfront ER visit for $250. You need to look at things like that to see, what am I getting for the premium that I'm paying, and compare that. Get several of these for different health plans that you're looking at, and this is what you want to look at to compare the different plans. Another one here that we have highlights, it's actually an HSA, and so you want to find out if it's an HSA. It also talks about it being non-embedded. With HSA plans, it's usually going to be a non-embedded deductible. Okay? So this is really what you want to look at, the summary of benefits and coverage, when you're looking at the different plans out there. All right, and then how to choose well. Now, there's an example in here that I want to walk through with you guys, just talking about how to choose a plan for John and Mona. So John and Mona are both retired and live in Maple Grove, Hennepin County. On January 1st, 2016, John turned 62, and Mona turned 61. They are both healthy and do not take any medications. Neither one smokes. They enjoy traveling in the U.S. and abroad. So for peace of mind, they want to know that they have access to a broad range of health providers, so that's really important to them. Depending on the difference in premiums, they may be willing to pay more to have Mayo Clinic, Rochester. Just so you know, to have Mayo, you are going to pay for that. It's really expensive to get them in the network. During their last employed years, they've contributed to a HSA, health savings account, and they can use their HSA funds to help cover their deductible and other out-of-pocket health care expenses. Okay. So, even though they have an HSA, I want to point out, they don't have to enroll in a HSA qualified health plan. They can, and if they don't, they can still use those funds from their HSA to pay for services, but they can no longer contribute to their health savings account. Okay? So, Company A, the total annual premium is $6,837. The deductible is $6,300 for an individual or $12,600 for the family. This plan has a non-embedded deductible, so it's gonna be, there's only 2 of them, so it'll be like they're on their own individual plans. Maximum out-of-pocket is the same in the, as the deductible. And then, so once their deductible is met, then they're covered at 100%. Co-payments or RX visits before deductible, no, and it's because it's an HSA. Remember I said that other than those preventive services, you're not going to get anything before deductible. And so with their premium and their deductible, the total is going to be $1,900, saying that they had met their deductible in a year. The most that they would pay would be the $19,437. Mayo, Rochester Mayo is not in the network, but they do have a pretty good network, which includes the University of Minnesota and Fairview. So those are really good hospitals as well. So that could be an option. Company B, the total annual premium is about almost $1,000 more. It's $7,633. Their deductible is less. They have a $5,000 deductible, but their maximum out of pocket is actually a little more. And so again, they'd be like they're on their own family own individual deductible because there's only 2 of them on the plan. Again, Mayo is not in the network, and it does have a decent network, but this one doesn't include either Mayo or the University of Minnesota or Fairview. Total premium and deductible, if they were to meet their deductible, would be $20,333. So it's actually a little more than the top one, and it doesn't have as good a network as the top option there. And then on the next one, Company A, the total annual premium is $10,737. Deductible is a lot lower. This is a gold plan. The other plans that we looked at were bronze plans. So with the gold plan, you are going to have a lot lower deductible, but they're paying a lot more for that, almost $4,000 more. They do get some upfront benefits. It's non-embedded. Mayo is not in the network, but they do include the U of M. They're paying, total maximum out of pocket is only $14,787 when you look at it this way because of the lower deductible, if they were to meet their deductible. But remember, John and Lona are pretty healthy. Company B, their total annual premium is $10,512. Deductible is $1,000. Maximum amount of pocket is $4,350 or the $12,700 for the family. They do get some upfront visits, and they also get some free e-visits, so they can go online and get a diagnosis that way. It has an embedded deductible. Again, I'm sorry, let me back up. This one has a non-embedded deductible, so they have to meet the family deductible on the non-embedded plan before their coverage will kick in. But the embedded deductible would be, they would only have to meet their individual deductible of $1,000. But the premium and the maximum amount of pocket for an individual is $13,512 for the individual, or the maximum amount of pocket is $23,000. The maximum amount of pocket is a lot more on this plan. You're looking at almost $10,000 more maximum out of pocket there. A silver option, it includes Mayo, but again, they're going to pay $4,000 more just to get Mayo, and they're really healthy, so why do they need it? They could always change health plans if something came up, a year down the line. Every year you have the option to switch. Or as an option to purchasing a plan with a lower deductible, they could use their HSA funds to cover their out-of-pocket costs if their health expenses are higher than they are now. And then if their health care expenses increase, they could choose again. They could choose a plan next year with a lower deductible and a lower maximum out-of-pocket. So they could always change later on down the line. with them, I would more or less go with the top option and recommend the bronze plan. So some enrollment tips for enrolling through MNsure. First of all, you have to use a desktop or a laptop. An iPad or an iPhone or a cell phone does not work. We recommend, these are the only two browsers that I know will work with this system, is Firefox and Google Chrome. I've never used any other one that will work. So if you don't have those, you just go online, Google it, and you can download those browsers. And then when can you enroll? Well, open enrollment started on November 1st. It runs November 1st through January 31st of every year. And then coverage begins on the 1st of the next year or the first day of the month. To get the cutoff for enrollment is the 15th of the month for most cases. So unless you have a special election like losing employer coverage, then you're allowed to go all the way through the end. But if you go past the 15th of the month, it's automatically going to kick out that following month. So let's say you enroll now, it's automatically going to kick out the month of March for you because it's after the 15th. It's too late to get February 1st coverage unless you have a special election like losing employer coverage. Then it's still a lot, it takes longer to get those special elections processed and to get the paperwork done when you go past, because then you've got to go back to MNsure and tell them, here's the date I want. It's going to take longer for them to process that application now because you've gone past that date, okay? Consumers who are eligible for Medicaid or CHIP, which is a special program for children, they can enroll at any time during the year. And then again, there's going to be special elections where you can enroll throughout the year, like, you know, getting married, having a baby, losing employer coverage, your income changes. Those are different elections that would give you a special election throughout the year. We kind of talked about that. You know, you have a divorce, you have a baby. Those, again, would allow you to get in or out of a plan throughout the year, outside of open enrollment. They're called qualifying life events. And then to enroll, you go to MNsure at MNsure.org. That's where you'll see if you qualify for any financial assistance. They have out there what's called, what is it called? Consumer checkbook. It was consumer checkbook. I think they call it something else now. But it will help you decide, you know, what plans out there. It also helps you to find out, you know, if you're going to qualify for a tax credit. They actually have a calculator that you can go out and play with before you actually create an account on MNsure and apply for coverage. So I would highly recommend going out there and playing around with their calculator, and that's where you have to sign up. Okay? There are plans that are sold outside of MNsure, but again, if you go off of MNsure and go direct to a health plan to buy coverage, then you won't qualify for any type of assistance. And then if you need assistance, there's what's called, again, Navigators. They're all throughout the state of Minnesota. These people are trained. They are certified by MNsure. You can meet face-to-face with them, create an application, and apply for coverage. They can do it for you. They can help you with the process. You can find them out on the MNsure website. I think you just go out there and I think there's like a need assistance. You'll see a link and just click on that and you can find them out there. You can call MNsure and they can tell you what's available in your area. I know that they have enrollment sessions all throughout the state that they are offering like daily to these navigators. There's also agents and brokers that are trained and licensed that can offer face-to-face help as well, and give you advice and help you on what plans work best for you. So with the navigators, they really can't advise on a plan, but they can answer basic questions and they can get you started in the right direction. If you really need, have questions about a specific health plan, I would recommend that you call the health plan directly and speak with someone in their sales area. If you have any questions, there's our contact information. There's also a card in your folder. I have my personal business card with me if you'd like my card before you leave. So do you mind asking what your situation is? Are you just shopping for next year or?
Well, I had coverage until September, and then I quit my job, so I could do music full time.
Okay.
But I had like good insurance through the union.
Okay.
But then I quit, so I had it up till September.
Okay, so you need to get something soon,
Yeah.
yeah. So you have, the deadline is the 31st,
Yeah.
so you want to get it done by then.
Otherwise, you have to pay a penalty when you
Yeah.
file taxes.
Yeah,
then?
otherwise you'll pay a penalty, and I don't know what the penalty is offhand inside your folder. I don't know if it has it on here, but let's look. I'll figure out the ask questions. No, but you can look it up on Minsure. I believe it's like yeah, it is. The penalty after 2016 is $695 per adult, or 2.5% of your taxable income. So it's on this Minsure Basics handout. Yeah, and also in your folder, I'll point out a couple other things. There's just talks about the enrollment and a little bit about Minsure. There's also a guide on the special election periods, and it talks about the different special elections where you can enroll outside of Minsure. There's a questionnaire that kind of helps you decide on, what you're looking for in a plan. So those are really good tools for you to use when you're out searching. Any other questions? Well, I really appreciate you guys showing up for the presentation today. Thank you.
Thank you.
Okay, I know I really screwed that up, didn't I?
Sounds good to me.
Okay. Seems like it went really fast.
So you said since it's past the 15th, that there's not open enrollment?
No.
How does that work?
Since it's past the 15th, you won't get coverage if you enroll
I
now.
see what you're saying.
So if you enroll now, it's the 20th. Up until the 31st, your coverage is going to start on March 1st. After the 31st, then you won't be able to enroll. So it's just too late to get coverage for February 1. The cutoff was the 15th of January.
Those numbers will be a lot better looking for younger people
Yes.
too.
How old are you?
25.
So, you'll find premiums out there probably for $150.
Yeah, and I don't
if
use like
that.
any medication. I don't go to the doctor like
Yeah.
ever, and
Yeah.
I'm healthy, so.
Let me see if I can get online. Okay, so yeah, comparison tools. Remember I was telling you, so right over there, that's where you would want to go if you want to just go in and look at and compare. So you could do here. It doesn't work really well on the iPad. Just so you know. I don't even know if it'll let me get all the way through, but so like. And then like if you wanted to get help for,
What is that? Is employer coverage available to everyone?
so if you have access to an employer plan where the premium is less than 9.5% of your income, you won't qualify for a tax credit. So if you do have access, even if you're
if
not
it's
enrolled in
available
the
to you?
plan, yep.
Yeah, see, I don't
Yeah.
have that now, so.
Then you wouldn't qualify, so
Okay.
that's why I said no there. But yeah, I'm just doing this as an example, I'm just gonna put in something. So this person, even though they fall below the 46,000, because their age is so low and the plans that are available to them, they wouldn't qualify for a tax credit.
I should try 20,000 in there.
Then they're gonna end up on Minnesota Care. then they end up on Minnesota Care.
Which is a total
The
another.
cutoff for Minnesota Care is 23,540.
So if you make less than that,
Mm-hmm.
so what is that then?
Then you will pay no more than $80 a month for your premium. If it's less than 15,000, like 15,600, then it's medical assistance and that's free. So if you're not working, you don't have any income, you'll end up on
Yeah.
medical assistance.
Yeah, because I totally just quit
Yeah.
my job to work on
Yeah.
music,
So
so.
you'll end up on medical assistance, you'll have good coverage, you'll have dental, and you just apply right here through Medicare. So what you will do is, you would go out here and go enroll now and create an account and apply. And then that's where you want to apply at. And once you've got your account created, once you're in there, there's going to be a big red arrow that says apply for a plan with discounts. That's the link you want to take, so you can apply for that.
Okay.
It's really easy to do. If you need help with it, give us a call. We can help you. We can walk you through it over the phone.
Sounds good.
Yeah. See if I don't know how far it's gonna let me go. Let's see. So once you register for account, you put in all your basic information here. And then you have to, be able to read the CAPTCHA there.
Mhm.
Click next. Then it's going to ask you some security questions like, did you purchase a vehicle in 2012? And, what's the county for the street address you provided? Things like that to verify you are who you say you are.
Yeah.
Once you get past that stage, it'll let you go in and create a username and password.